tonight, chapter 24. Talking about some hematological and renal emergencies. So, what does that mean? Hematologic system. Blood represents its own organ system, has specific functions, control of bleeding by clotting, delivery of oxygen to the cells, removal of carbon dioxide. We've talked about this stuff, so it should not be too challenging. We also remove delivery of other waste products to organs that filtrate and remove them from the system. Okay? It's made up of solid components, red blood cells, white blood cells, platelets, suspended in plasma. Okay? Medications can affect some components of the blood. Blood clotting, aggregation of platelets, is the body's most rapid and initial response to stop bleeding. Clotting factors are a group of proteins produced in the liver and released into the bloodstream. Once activated, clotting factors from clots through clotting cascades. So you know how this works. You cut yourself, your body starts to release clotting factors to help you to keep from bleeding to death. Coagulopathies. Abnormal clotting of blood can occur when the body forms clots too readily or the patient clots too slowly. Certain diseases make patients more prone. Advanced liver disease, a lot of these patients have clotting problems that don't allow them to clot appropriately. Hemophilia and von Willebrand disease. So, identifying patients with coagulopathies, certain medical conditions, medications with normal ability to form clots can worsen patients' disease. So blood thinners, this is our big one, right? People that have strokes, people that have AFib, they're placed on blood thinners, okay? There are a lot of different blood thinners out there these days, but Coumadin, also known as warfarin, is one of the most common, okay? You're gonna see that in a lot of your patients. These patients start to bleed, they start to really bleed, okay? Because their blood's thinned out, they don't clot as well. Anemic patients, they have a lack of normal amount of red blood cells. Acute anemias could cause sudden blood loss. Chronic anemia could cause excessive menstrual periods, slow GI bleeding, or some diseases that affect bone marrow. Sickle cell anemia, it's a genetic disease affecting red blood cells, most prevalent in African Americans. Defective shape resembles a sickle. Cells have a short lifespan leading to anemia. Okay, so sickle cell anemia, short lifespan leading to anemia, most commonly affects African Americans, Indian or Middle Eastern descent. Okay. Complications: destruction of the spleen, sickle pain crisis. This is probably the most acute, often thing you're going to see. They start having severe pain due to a sickle cell crisis. Okay, they can have acute chest pain, priapism, stroke, or jaundice. 1 in 12 African Americans has the sickle cell trait. It's quite a bit, right? 1 in 12. Sickle cell trait doesn't always lead to complications, though. Some people may go their entire life without knowing. We're going to administer supplemental oxygen, monitor for inadequate respiration, monitor for signs of hypoperfusion, shock. We're going to transport to a stroke center if a stroke is suspected. A lot of these patients may mimic a stroke with sickle cell crisis because they may have some angioedema or that kind of stuff going on too, so that you could go down the wrong path if you're not careful. The renal system, okay, we've got 2 kidneys, 2 ureters, and 1 urethra. It's responsible for filtering blood, removing waste, maintains the fluid balance, maintains the acid-base balance. Okay, so this system helps us stay in a state of homeostasis, right? Stay in a normal state. It filters blood, removes waste, kind of keeps us from being overly fluid loaded, keeps that acid-base balance. We don't want to be really acidic. We don't want to be too much on either side, okay? So diseases of the renal system affect many different portions. They range from minor to life-threatening. UTIs. UTIs about, seems like 90% of our elderly patient has a UTI when we take them into the hospital. I know that's not true, but they have them very frequently, right? It's the most common disease that afflicts renal and urinary system. It's caused by bacteria. It's usually limited to the bladder. Can cause pain and frequent urination. If left untreated, can result in pyelonephritis when the UTI sends up the ureter into the kidney. Okay? We're going to go into kidney stones. Usually made up of calcium and formed within the kidney. When in the kidney, they cause no symptoms. When they become dislodged, can cause unilateral flight pain that radiates to the groin. Patients may report nausea and vomiting. Kidney stones are extremely painful. Okay, this is one of the most painful things we're going to talk about. Right up there with pregnancy. Kidney stones are extremely painful. We got to treat these patients aggressively. Make sure we get them in that position of comfort. Do whatever we can to make them comfortable. It's hard without having pain meds as an EMT, but we got to do what we can to make them as comfortable as possible. Urinary catheters, as a result typically of renal obstruction of bladder outflow or a neurological disorder. Okay. Urinary catheters to drain urine, commonly inserted in the urethra, may be placed through skin. Complications of UTI, pretty common with catheters, or local trauma at the site of the catheter insertion. A lot of times these people will be bleeding because they accidentally pulled out their catheter, or they had some sort of problem. Renal failure, this is a big one. Occurs when the kidneys lose ability to adequately filter and remove toxins. Acute failure typically results from shock or toxic ingestion. Chronic failure may be inherited or secondary to damage from uncontrolled diabetes or hypertension. End-stage renal disease is irreversible renal failure. It requires dialysis. So we have thousands, hundreds of thousands of patients across the world that go get dialysis, 2 or 3 times a week. Some are going Monday, Wednesday, Friday. Some are going Tuesday, Saturday, or Tuesday, Thursday, Saturday. They really do there's just tons of these people out there, all over this county, all over the place. So they can do hemodialysis or peritoneal dialysis. 90% of those receive hemodialysis in specialized centers. There's one in Warrensburg. They are literally all over the place. If you drive by, try to pay attention. There are dialysis clinics everywhere. It's a huge portion of our population. There it is. More than 400,000 Americans on dialysis who are treated in dialysis centers undergo 3 treatments a week, each lasting 3 to 4 hours. These poor patients in renal failure, they go in there at like 4 in the morning. They don't get out till after 8. Just think about how unhappy you would be. They feel like crap because they're literally having to have all this fluid pulled off of them, pumped off them. It's not a fun situation. So they don't feel well. They sometimes have complications. They have a shunt that may be bleeding. We cannot take blood pressures on their shunt side. Okay, so pay attention. Ask your patients, hey, can I take a blood pressure in this arm? They're going to know. They're going to tell you no because they don't want that shunt messed up. So be careful with that. Make sure that you pay attention. If you see a fistula, what looks like a huge vein, like just a massive vein in their arm, it's not a massive vein most likely. Especially if they're in an elderly population, it's probably a fistula. So pay attention. Don't take blood pressures on that side. Realize that can mess them up. Only 8% treat themselves at home. They can do that with the peritoneal dialysis. And they often rely on EMS for transport to and from dialysis. Luckily here, we don't have much of that. Okay? Patient connected to a dialysis machine that pumps blood through specialized membranes. Treatment lasts several hours, multiple times a week, like we talked about. Okay? So they have this is kind of a good picture of how hemodialysis works. They have blood removed for cleansing through their shunt, which is normally it's higher up, but it's all right. It goes through an arterial pressure monitor, through a blood pump, heparin pump to prevent it from clotting. They have a pressure monitor, dialyzer, venous pressure monitor, air trap and air detector, and then a clamp that sends it back to the body, right? Clean blood returns to the body. So they get all the junk out of it. Because remember, that's what the renal system is supposed to be doing, right? It's supposed to be cleaning out stuff. Well, we have to do it for them with dialysis. So there's a 2-port catheter or an AV fistula. I think we see more fistulas, but who knows? So here's a 2-port catheter. Yeah, I don't see many of those. Mostly what we see is the fistula. There is a fistula. See that big old notch right there? Looks like a massive vein. These scars aren't always so prominent, so looks like a massive vein. That is what they poured into, okay? Sometimes those bleed. They can even require a tourniquet sometimes to get them to stop bleeding if it's pretty bad. Peritoneal dialysis uses the peritoneal cavity's large surface area. Special fluid infused into the abdominal cavity, left for several hours to absorb waste and excessive fluid. Fluid is removed and discarded. Okay. Continuous ambulatory peritoneal dialysis, gravity exchange process repeated several times a day. The continuous cycler-assisted peritoneal dialysis is a machine used to fill an empty abdominal cavity while someone sleeps. I don't see too many of these, but who knows? They're probably out there. Okay. So there's two broad groups: loss of normal kidney function, complications of dialysis treatment. Most dialysis patients have underlying medical factors. This is very true. A lot of them have diabetes. Most of them are going to have hypertension. Think about it. They're not getting rid of that fluid, so it's staying in their system. They're going to have a higher blood pressure. So they have some other things that could cause problems. If they miss dialysis, it's going to be a huge problem. This is why it's so important these people get to their treatments. They present with signs and symptoms similar to congestive heart failure. They have shortness of breath, edema, and electrolyte disturbances. We got to assess their airway, breathing, and circulation, obtain full set of vital signs, and be aware of those fistulas. We do not want to run a fistula. Okay? They only have two arms. Okay? And they need that port. So you may have to take a blood pressure on the other arm. If you can't take it on the other arm for some reason, you may have to get creative. You may have to palpate one. You're going to have to work through it. You might have to use a monitor cuff on a lower extremity. Monitor vital signs closely. Have your AED ready. Transport to facility capable of dialysis. These patients shouldn't need an AED, but it's always good to be prepared. They could have bleeding from their AV fistula site, like I talked about. Clotting and loss of function of the AV fistula. Could have a bacterial infection of blood due to contamination, or peritonitis. Once again, we're going to assess our ABCs. We're going to control our bleeding. Use direct pressure elevation, hemostatic dressings as needed. So hemostatic dressings are going to be like your quick clot kind of thing. And then if bleeding cannot be controlled by any means, a tourniquet should be applied. Because we can't replace red blood cells, right? So if we absolutely have to, we should apply a tourniquet. We're going to administer oxygen and treat for shock. There it is, treat for shock. If peritonitis is suspected, we need to transport dialysis fluid for confirmation. It's a good idea. Then they can test it. Kidney transplants. Kidneys are the most commonly transported organs. Approximately 16,000 transplants per year. Patients spend their lives on a special class of drugs to help prevent organ rejection, and they have increased susceptibility to infections. Okay? All right, we talked about a lot of stuff there. Make sure we know about anemia being lack of red blood cells and circulation. I think that's one of the topics on the test. What does our blood consist of? Red cells, white cells, and plasma. You need to know what sickle cell anemia is and what patients it affects most. And you need to know what renal failure is, which we talked about. Okay? Should pretty much get you ready for the test on Wednesday. If you have questions, let me know.